Hello and very warm welcome to the Arise interview, 60 minutes of big questions about the big stories from the news and beyond with fresh insights and critical analysis. I am Christian Ogodo. Thanks for joining us. Coming up in the next hour, after 5 weeks of a complete lockdown of economic activities to contain the spread of the virus, Nigeria's President Muhammadu Buhari announced the gradual easing of the lockdown, which we've entered the second week, in order to tame the effect of the pandemic on the economy and its citizens. Guidelines were reeled out on how the relaxation will take effect, but we've seen how Nigerians flout those guidelines and the coronavirus cases in the country continues to spiral. What does this portend for the nation? We'll speak to the national coordinator of the Presidential Task Force on COVID-19 as we assess the impact of the recent relaxation order of the lockdown and likely actions to be taken. Also, we'll take a critical look at Nigeria's testing capacity. All in a moment. In Nigeria, some businesses have since reopened after the first phase of the lockdown was eased. Nigeria medics have expressed disquiet over the loosening of restrictions, and they have warned of a frightening scenario due to lack of bed spaces while the pace of infection seems to be growing. The fear that the deficit in healthcare facilities and professionals would not be able to handle a drastic or dramatic upsurge that may arise due to the high incidences of community transmissions. Also, there are concerns about Nigeria's testing capacity, as correspondents say the country is sitting on a keg of gunpowder. Well, for more on this, I've now been joined by Dr. Sani Aliyu, who is the National Coordinator of the Presidential Task Force on COVID-19. Very warm welcome to the Arise interview, Doctor.
Thank you for having me, Christian.
I know it's been some busy 2 months now for the task force, but let me start by asking you what still agitates the minds of Nigerians. The Kanu incident is over a fortnight now. Do we have test results of what really went wrong with the high number of deaths recorded in Kanu before the confirmation of the COVID-19 outbreak there or infection there?
So we are still expecting the formal report. The initial investigations have been done. As you know, there's a ministerial committee that was sent to Kanu, headed by Dr. Nasiru Gorzu, one of the permanent secretaries in the Federal Service. And they have worked with the state government through the state emergency operation centers, and the support they have received from the government has actually been quite good. We're still awaiting the formal report, so I cannot say categorically what the reason is, whether or not it is due to COVID. But one of the things that we are concerned with, and this doesn't apply to just Kanu, but it's across the country that we're seeing, is a trend where people are unable to access care in health facilities for routine medical illnesses.
Yes, but why is that so? It's the fear of the pandemic. The hospitals, the private hospitals don't have enough of the PPEs.
So 50 to 60% of the population in the country, when they are sick, they don't go to a public health institution. They go to a private clinic or a private hospital. In Kanu, at the moment, virtually all, well, most, if not all, of the private hospitals in Kanu are closed because of the COVID issue. And to me, it's extremely important that if you have severe malaria, if you have a heart problem, if you have urinary sepsis, you need to be able to access medical care. And that's why we're currently working with the state government to get those private, not only the private, but also the public institutions, public health facilities, to open up. There are ways around this. So private sector, for instance, it's not government that will provide PPE to private sector. The only
But there's an intervention fund. Are you allowing them to assess it? The risk value or chain is very high.
No, so let me correct you there.
Okay.
The only PPE that you cannot get from local manufacturers in country is the FFP3 mask. You can get surgical gloves, you can get masks, you can get gowns, you can get gloves locally. So from the private sector side, it's the responsibility of the people owning the private facilities to make sure they have enough PPE to protect their healthcare workers. The solution is not to close the private facilities. The solution is to work around this and make sure that you have good infection control processes, you have good triage, so that when a person comes in who is sick with heart failure, you know he hasn't got COVID. You know he hasn't got COVID. But of course, if people need healthcare and they cannot access healthcare and they are sick, what do you expect will happen? They will die. So we are working very closely with the state government as well as other parts of the private sector. Open up, make sure that you have processes in place to triage, and you take out those that have very high likelihood of COVID. You triage them aside, and then you get them help. But the solution is not to close health facilities, because the majority, till date, the majority of illnesses presenting to the hospital will not be due to COVID. And that's the message we're trying to get out. Private facilities should also invest in making sure that they have the right PPE equipment to look after the people that are presented to them with healthcare. It is not right for the society, the community, to have 50-60% of their healthcare needs put aside because of the COVID pandemic.
And the kind of situation in Kano, which is still under investigation, do you want to liken the same trend pattern in Yobe, Zamfara, the kind of number of deaths they've recorded in a week?
So certainly we are looking at this, but one thing you should also remember is you need a baseline to know whether there's an increase in deaths or not. So unless you have that baseline and then you investigate to see whether there's an increase in cases, it's very difficult to say precisely whether those numbers have changed or not. I'm not putting it aside and saying, no, look, what is happening in, I know Jigawa, the report is out, but it was not an investigation done by us, and therefore I cannot provide that information. But certainly I know the final report is probably with the state government, and they will be able at a certain point to be able to provide that information to the general public. But certainly we need to know at a baseline what is happening first. What's the average number of deaths? Because remember, Nigeria is a large country. We have a population of 200 million. How many people do you think are dying every day? It's not a small number. So, and there are other factors that will also come in. I think, generally speaking, the likelihood is these are collateral effects of the COVID pandemic, not just COVID in itself. Because you see, if you
it's a combination.
Yes, a combination. If you're in a lockdown situation, in the first place, you don't have easy access to money. You don't have easy access to transportation. You'll have to think twice before you take somebody out. There's that fear that if somebody goes to a teaching hospital or a facility that looks after COVID, he might catch, or his loved one might catch COVID. So the fear elements as well in terms of accessing hospital care, and therefore the delay in accessing healthcare could also be contributing further to the mortality. So I think it's a combination of factors. And it also provides us with there's a reason why I think post-COVID, a lot of things will change. And one of the key things that need to change is even the way we register our deaths. Because in this country, we don't have statistics with regards to death. We don't have registration for deaths, etc. Whereas elsewhere in other countries, if a person dies, straight away there will be documentation before they leave.
Registration for death. But the National Population Commission and even the hospitals
yes,
and the rest.
So
maybe you're talking of the hinterlands.
The hinterlands, yeah, exactly.
Yeah.
So if you go to Kano, I know a lot of the deaths, if people die at home, for instance, they might get a death certificate afterwards. But certainly, as at the time of the death, there's no documentation.
No autopsy and the rest because of religious.
It's not even autopsy. Sometimes you don't even need an autopsy. Just a documentation of what a person died with. For instance, if you go to the UK, there's always a column there for the key reason for the death, the contributing factors, etc. So I think our birth and death registration is another reason why we need to update this and make sure post-COVID that all these processes are in place so that we have a good baseline in terms terms of what our death rates are, and any spike or change in the frequency we would pick
be
up
able
immediately.
to get the ratio.
Exactly,
Is
exactly.
it rising? Is it falling?
Exactly.
Or is it flat?
Yes.
Okay, Dr. Sani Aliyu, I would ask you to just stay with us. We want to take some messages. Okay, I've just been told that we still have ample time. Okay, let me ask you now, basically, what are the hurdles that you face in combating this COVID-19, the presidential task force, I mean?
So the main challenge we are having, as you probably know, is the level of compliance with some of the guidelines we have set. So when we relax the restriction, a lot of thought went into relaxing the restriction. Should we continue with the lockdown for a few more weeks? Should we tighten it further? Should we expand it across the country, or should we relax the restrictions? And we looked at various models. And what was very clear, including examples from other countries, is provided the populace, provided the community, the society are ready to abide by the alternative restrictions, the alternative guidelines, such as physical distancing, such as making sure you sanitize your hands, respiratory hygiene, hand washing, keeping to yourself unless you have to go out, etc. Those measures, if they are delivered consistently by everybody as a bundle, rather than you just choosing, you just wear a mask but you will keep on interacting. If those measures are taken and delivered at the same time as a bundle, the effect they will have is very similar to that of a lockdown. But they will have the advantage of allowing some degree of economic activity to proceed and allowing people to come out and go to work, etc. Because we know the two main reasons why a lockdown doesn't work. The two main reasons is, one, people run out of food and water. There was a survey that was done, 83%, the main reason why they broke a lockdown was because they were running out of food and water. Secondly, they were running out of money. The third, which was less frequent, 15-16%, said they were worried about losing their job. But in a society where the majority, more than 80% of our population, work in the informal sector, where they have to go out on a daily basis to seek food, and you ask them to stay at home for 5, 6, 8 weeks, it's not easy. For the elite, it might be easy because they will go and buy food, stock up food, get ready, keep the children, watch TV. The generator runs 24 hours a day, and it's fine. You can run with it for 8 weeks. But you can imagine somebody who has to go out every day to seek food. And there's a limit to how much you can keep that population down in such a situation. So it was a pragmatic decision. Okay. It was almost like a deal with the society. Okay, we will relax this, but at the same time, we expect you to do this in return, and then we'll get on top of the pandemic.
All right, okay. Dr. Sani Aliyu, coordinator of the Presidential Task Force. We'll take a short break. When we return, we'll interrogate more on how the PTF is coping with the pandemic, combating it.
Thank you.
You're still watching the Arise interview. Time for a short break. Stay with us. Welcome back. You're still watching the Arise interview with me, Christian Ogodo. I have as our guest Dr. Sani Aliyu, who is the national coordinator of the Presidential Task Force on COVID-19. Yeah, Doctor, you were telling us about some of the hurdles that you face and why you had to take certain measures, so that you can really mitigate the spread of the COVID-19 and be able to carry out enough tests. State governments, again, yes, they are at liberty to expand their own or the measures you've put in place, but we're beginning to see certain excesses like the arrest and confiscation, auction of the citizens' vehicles, demolition of property, and the rest. Is that necessary?
So, of course, when you have a pandemic, it's the role of government to make sure that they put in place measures to get on top of the pandemic. But at the same time, we expect people's rights to be respected. There are certain things that do affect the pandemic. So for instance, if we are told there's a curfew from 8 p.m. to 6 a.m., if you go out, then there should be some repercussion, otherwise others will follow. Those repercussions need to be proportionate though. So, for instance, penalties like what is going on in Kaduna State, for instance, where they are fining people penalties. That's the sort of thing you'd expect, because even
Or
when you go to the UK
work,
or
yeah.
community work, because even when you go to the UK, US, etc., those are the sort of penalties. And with any restriction or any law, there has to be some form of punishment to stop people from breaking those rules, which I understand
But
quite well.
not the one that is so excessive.
But
that
not
tramples
excessive,
up,
of course. Yeah, I don't expect. We don't expect. Certainly from the PTF side, we expect people to be treated with dignity and respect, even when they do break the law, and to make it very clear that there are repercussions. But those repercussions will need to be proportionate and within the ambit of the law as well.
Okay. Results of testing is infection rate it keeps rising daily. We've now crossed the 4,000 mark. Some people are saying before the end of the month we just may be hitting 10, double digits now in the thousands. You want to tell us about the country's testing capacity? It's been described as so low, about 120 tests per million. That's really abysmal.
So when the epidemic started, we didn't even have testing available at all. As a country, we didn't. A lot of countries, we were one of the first 5 countries in Africa to have testing introduced in country. But it's been a progressive increase. At the moment, 2 days ago, we were able to hit 2,500 tests in a single day. At present, we've tested about slightly more than 25,000 persons, and we are ramping up, because remember, Nigeria is a large country. You cannot compare Nigeria, for instance, with Malawi or some of the smaller African countries. The laboratory capacity when we started was limited to only Abuja and parts of the southwest, and Irua as well. At the moment, we have about 21 labs operating. There's also a lot of demand for the test kits, a lot of demand for the viral transport media. The supply chain is not that secure. But all I can say is we are working very hard with NCDC. The NCDC are actually doing a very good job in this regard. If you look at the graph of the number of tests, it's really been going up. And there are new machines that will be coming through over the coming weeks. We've got the Gene Expert machine, which has been used for TB, for tuberculosis across the country. We have more than 300 of those machines across the country. And we are trying to introduce at least 20 something of them, because they need to come with that's what we call safety cabinets. If you look at the way we process these samples, they have to be processed with protection provided for the person doing. So those safety cabinets are only available in some of the facilities that have Gene Expert. So once the cartridges come through towards the end of this month, in the next week or two, we're getting about 18,000 cartridges of Gene Expert, the Gene Expert COVID-specific cartridges. So although these tests will not hugely increase the numbers, because there are tests that you can only do 4 tests per run, which is insignificant compared to some of our machines in Lagos and Abuja that can do 2,000 tests in a day. These can only do 4 tests within a 1-hour period. But the advantage is every state would have some capacity to be able to test close to the community.
They want to do it
randomly.
So that is the kind of integrated testing that you are bringing in to the PTF.
So the network is developing, and I think over the next few weeks we should be able to ramp up to at least 4,500 tests a day. And our goal...
So my projection is slightly correct, or almost correct, that at the end of this month we'll be seeing, we'll most likely be seeing double figures in the thousands now.
For the positives or for the tests?
Yes, for the positives.
So the positives, on average, 15% of the tests we do are positive. That gives you an idea, 15% of the positives. So 15% of the tests we do come up positive.
Yeah.
So if we're doing more and more and more tests, we're going to have more and more positives. It's one of the reasons why the number of positives has really gone up, because the number of tests has increased substantially. And remember, the incubation period for COVID is between 2 to 14 days. There's a tail of up to 3 weeks. So the infections we are seeing now are actually infections from people that got infected before the lockdown was relaxed.
Because they were refusing to come out to be tested?
Oh no, because the incubation period is 2 to 14 days, and we're only we're less than 7 days into the relaxation of the lockdown. So they probably acquired it during the lockdown period rather than after. So what I'm trying to say is we're yet to see the impact of the relaxation yet. In terms of the numbers, it will probably be in the coming week or so.
You are an expert in virology, am I right? I know
Microbiology.
in microbiology, yes. And some Nigerians don't seem to believe in the presence of this virus for one reason or the other, whether for political expediency or just sheer ignorance, or they just say, look, this is just a common flu that we, occur when you have a change of weather, whether from dry season we're going into the rainy season or vice versa. And some others again say it's a money spinner for those in authority.
People have died from COVID, Christian. People have died from COVID. So I think it is not right for people to say that it is a money spinner, because it's in a way you're not being sensitive to those that have lost loved ones to this pandemic. The whole world is affected. In the UK, at one point, more than 1,000 people were dying of COVID. This isn't a situation that we have created in Nigeria, whether money spinner or not. Yes, the majority will have mild symptoms. 80% will have mild to moderate symptoms, and they will get better. But 20% will require hospitalization and oxygen. 5% will require intubation and ventilation. In countries that have very modern health systems, they have struggled. In Hausa, we talk about if your neighbor's beard has caught fire, what do? You make sure you put water on your own. And that's what we're trying to do. We're trying to prevent unnecessary deaths from COVID infection. We're not trying to create panic within the society. But there's no doubt, you talked about the increase in the number of deaths in Kano and other places. Why are we investigating it? It's because we know that it could be COVID. And we need to find out. And the only way we can find out is by testing. And with testing, I cannot drag you and put you down and take a sample. I can only ask you that if you have symptoms, cooperate, have that awareness within communities. And more importantly, for a disease that does not have a cure, a disease that does not have a vaccine, that you cannot take anything to prevent you from catching it, and that it kills, the only way that you can stop it is by changing your behavior. So I think those that are denying that either COVID exists or COVID kills, or that we are creating a scenario to generate resources, there are easier ways of getting money than trying to bring in a pandemic. The whole world has come to a standstill because of COVID. Go to Saudi Arabia. There are no prayers, no Umrah. For the first time, there will probably not be any Hajj. Go to the Vatican. It's practically empty. You think we're creating this situation? No, we're not. So my plea to those that think or are being very cynical about COVID is to please think again. Because if you have loved ones, particularly those that are at high risk, the elderly, those with diabetes, other comorbidities, and you continue to take those risks, you could end up losing your loved ones. So my plea to those that do not believe in COVID is let them think again. Yes, the majority will be fine, but there will be a significant cohort of people that could die as a result of this.
Okay, very quickly, before we go on another break, vaccines. There are talks by the WHO that Nigeria has accepted to be one of the trial nations for COVID-19 vaccines. Did the PTF recommend that? Why does the PTF want to use Nigerians as guinea pigs for such exercise?
So not at all. So when it comes to vaccines, the way vaccines are produced is you go into a laboratory, you pick up the organism, you look at how it causes disease, you look at how you can stimulate the body's immune system to fight that disease condition. With coronavirus infections, they have been working very hard. There's a group in Oxford that have developed a vaccine, and whether it's a vaccine or a drug, it has to go through a series of trials before it can be licensed. So that series of trials would require certain regulations. One of the regulations is consent. And nobody would have a trial of vaccine without consenting to it. Nobody. It's in the interest of our country to make sure that when it comes to a vaccine that is credible, I'm not talking about bringing in a particular cure that has not been tested or tried. I'm talking about modern medicine.
The Madagascar COVID mixture.
I will not even specify. I wouldn't want to set up a diplomatic row on this program, but I'm talking about things, vaccines that have gone through modern therapeutic designs, etc., and trials. It's in the best interest of our country to make sure that we are part and parcel of any modern trial so that our people can benefit from it.
All right, we'll talk more on that. Let's just take some messages again. You're still watching the Arise interview. We'll be back after this time out. Stay with us. You're welcome back to the Arise interview with me, Christian Nogodos. They have as our guest the National Coordinator of the Presidential Task Force on COVID-19, Dr. Sani Aliyu. And Dr. Aliyu, we're talking about vaccines, clinical trials, and why it must go through a process, scientific. How about the herbal formulations here in Nigeria, where I know right now the Federal Ministry of Health has set up a committee to liaise with the NAFDAC, the regulator for foods and medicines and the rest, to test the efficacy of a new mixture, cough mixture. That's what these people are saying.
So, Christian, whatever it is in terms of drugs, whether it's a herbal drug or whatever, if we want to use it within modern healthcare systems, they have to go through a process of clinical trials. So yes, there might be something that the Federal Ministry of Health will be working with NAFDAC, but as far as I know, they will still have to go through the necessary process. There's nothing like licensing. You bring an agent, you bring something to me now, I drink it, I get better, and then I go to NAFDAC and say, right, let's register this. It has to be done properly because you're dealing with humans.
Yeah.
And the risk of harm, one of the things with medicine is do not cause harm. And there are drugs in the past, prior to when the regulations became more strict and enforced. There was a drug called thalidomide some years back, I'm sure you remember, some decades back, that was being used by pregnant women to stop them from having nausea and vomiting. And what did it lead to? It led to a lot of children being born without limbs. And since then, the medical fraternity has really strictly regulated the registration of medicines. You have to go through a particular process. That process will look at how effective is it, does it have significant side effects, does it have long-term issues, etc., before it is finally licensed. And I'm sure NAFDAC will do the right thing, but they will probably have to involve other research bodies as well, rather than just NAFDAC.
Absolutely, yeah. And we're hoping that the Nigerian universities too will be coming up.
Indeed, our academic institutions
absolutely.
Are very important.
I'm only worried that they are still on strike, in the last
schools are closed anyway.
So when schools are closed, how do you carry out research in the laboratory?
No, I think the academics are probably, there has to be, from the research side, is different from teaching students. So there might still be some degree of activity going on at a lower level in some of the states, maybe in the labs, etc. It's just like the way we have relaxed some of the restrictions. People can still go to work. It's just that they have to keep to those measures and within a shortened time frame.
Okay, very quickly, still talking about research efforts and finding a cure or a management of COVID-19, because sometimes you say you don't find cure, it's just the management and there's only God cures. Is the PTF already funding any of these researches ongoing?
So we have a partnership with Nigerian Institute for Medical Research, but primarily the PTF is there to provide a multi-sectoral response and to support, but we are not an academic institution per se. We do have a small research fund that we are trying to use to support some of the medical research institutes, but it's not a huge amount of money. What I can say is we are very grateful to the academic field. They have been really, really useful when it comes to taking those decisions that need to be based on sound science and data. They have been providing us with a lot of data and recommendations based on how the epidemic is proceeding in the country. And we have been using this quite effectively to take decisions at the PTF level.
Very heartwarming to hear that. Now, let's talk about contact tracing, because that is another key hurdle or area that you have to expedite action on quickly. The United Kingdom, for example, only last week introduced the contact tracing app starting from the Isle of Wight. A Nigerian has developed same application to help not only in tracing, but even seeking or making appointments with the doctor and the rest, and they will get the result, blah, blah, blah. And we hear they've written to the PTF for approval or support and the rest. It's called COVID-19. Have you received anything like that? And how have you expedited action on your contact tracing?
So, Christian, we get a lot of correspondence from people who are interested in helping, and of course we will continue to encourage people to come forward. But of course it's not possible to respond to each and every request. We are working with the Federal Ministry of Communication. We are working with Nigeria Comsat and some of the security agencies. I can tell you some of the data we had when we had the lockdown, for instance, is pretty robust. And we are also looking at various systems. Nigerians are incredibly good at developing new concepts, etc. And what I would say is, if you have a new concept, PTF doesn't necessarily need to come and say, right, here's some money, let's do this. There are ways around this. You can provide that through the state structures. You can provide that through NCDC. But it doesn't necessarily have to be sort of...
Even to the Ministry of Communications and Digital Economy.
Yeah, exactly. So the PTF is not an endorsement body. Remember, we're just a task force, a committee
well,
set up.
They are looking at the emergency funds there. It's plenty of billions.
Plenty of billions from the private sector, which we are grateful to. The vast majority of funds would remain with those entities. So, for instance, the NMPC fund will remain with the NMPC. The COVID fund, which is the main private sector fund, will remain with the private sector.
Yeah.
So also Global Fund, so also the World Bank Credit. None will come through the PTF in order. We don't disperse money. We are not even a procurement entity. We don't have accounting rights. We are a committee with a fixed lifespan of 6 months, because we hope this pandemic will be over in the next 6 months. So even the money that's coming from the federal government, for instance, the different MDAs, Federal Ministry of Health will take their own, NCDC will take their own, humanitarian will take their own, etc. We're just there to provide oversight and provide policy direction in terms of how the pandemic. We're not an endorsement body, because I get a lot of requests from people saying, I have this kit, can you buy it? Or I have this ventilator that I have manufactured, can you buy it? Well, I'm sorry, we provide insight to those bodies to help them take decisions. But procurement, we're not involved.
Is the Ministry of Health doing the procurement now, or still the Ministry of Agriculture?
No, it's the Ministry of Health have had their procurement restored.
They have it restored?
Yes, it's been
That's
restored.
really good news and good to know. So that I think this pandemic, you would agree with me, some people see it as one way of redeveloping Nigeria's healthcare system, particularly at the primary level.
It's opportunity is not the right word, because people are dying from this. This is an unfortunate set of events, having a pandemic. But it certainly gives us the chance to reset the health system, because it's very clear, if you look at a country in terms of development, it's not just about infrastructure. You also need to fund health, and you need to fund education. A healthy population is what creates wealth for your country. You can see the effect of the pandemic globally, where we've gone into recession. It's had a significant impact on even Nigeria's ability to fund its own development sector and initiatives. And that's why post-COVID, things will change, Christian. We are already looking in the long term. We are planning to have an isolation facility, 40 to 45 bed isolation facility linked to a federal center in every state, and have a functional at least 10 bed ICU facility in every state linked to a federal teaching hospital or medical center. This will provide us with the infrastructure for future epidemics such as Lassa or Ebola that come. And at the same time, we're training our healthcare workers to enable them deal with infection control, because what is very clear is that pre-COVID, we were not really practicing a lot of infection control in our institutions. A lot of institutions, if you walk in, there's no water to wash your hands, this sanitization, the hand, etc. And there will always be advantages of having these sort of measures. So, for instance, a lot of childhood infections are linked to bad hygiene. Mm-hmm. Gastroenteritis, childhood diarrhea is one of the main causes of childhood mortality. Mm-hmm. But with all the things that we are instituting now, this social distancing, washing hands, etc., the effect is not just on COVID, Christian.
Yeah.
The effect will be on other health conditions as well. Mm-hmm. People will be a lot healthier post-pandemic, and that's why we have to make sure that we protect ourselves. We are alive post-COVID, because that post-COVID era will be very different to what we have now, and we need to be around to be able to benefit from that.
There are a lot of needs, necessities for the people. The basic ones, I know, there are just three. Washing of hands, that's personal hygiene. How would the rural folks have that when they don't have clean drinking water?
But what do you do with it? You make sure they have clean drinking water. So we invest more in making sure that that infrastructure is there. We invest more in education, because the more educated you are, the more likely you are to know the things that would harm you and the things that would not harm you. The more likely you are to accept advice when medical authorities, for instance, say, actually, if you do this, this is what's going to happen. The more likely you are to have a proper perception of risk if you go out. So education is important, health is important, and redirecting our resources to these two elements together with the infrastructure. I'm not saying infrastructure is not important, but the three need to go hand in hand for a country to develop.
For development.
Absolutely.
Yeah, for development. Yes. I don't know if we still have enough time. I was just going to quickly ask you. Okay. We got there a minute here. Would you be able to summarize in 1 minute the claim by Kogi State and Cross River State of zero COVID-19? Are you investigating that?
So we are working closely with both state governments to look at what the issues are with regards to the epidemic in their states, and we are getting traction. We have a team that will be going to Cross Rivers early this coming week.
The one that went to Kogi, they ran away.
So we've already reached out to Kogi State. I know every state government wants the best for its people.
Okay, Dr. Sani, I think we can continue this after the break and to expatiate further the efforts you're making. You're still watching the Rise interview. Stay with us. When we return from the break, we'll continue more discussions on COVID-19. You're welcome back, and you're still watching the Rise interview with me, Christian Nogodol. We're live in Nigeria's capital, Abuja. Thanks for staying with us. We still have Dr. Sani Aliyu. Doctor, you were talking about efforts being made, about the claim of Kogi and Cross River State over the zero infection level for the COVID-19. And you said you're sending a team to Cross River, and Kogi, NCDC officials were chased away, or they ran away. Wonder why that should be so.
I can't go into specifics for every state. All I can say is I'm sure every state government will want the best for its people. And as federal government, we will continue to work very closely with those states to make sure that the state of the epidemic is established. If they don't have any cases, that's great. That's wonderful news. They should continue doing the good work. But in the event that they do have cases that are not being picked up, some of these cases could end up dying, and that's why we have to work with them. And we have a very harmonious working relationship with all the state chief executives, and we'll continue to reach out. Some of them are people that we've known for many years. They are friends, they are colleagues, and we have a lot of respect for them. But certainly, I'm pretty sure no state government would want any of its citizens to come to harm. With COVID, to me, there's no shame. There shouldn't be any stigma attached to this. It's just like any other infection. You cannot control it. Once you're exposed to it, it's out of your control. So there shouldn't be any blame. Neither should there be any scoring of saying, oh, this is the worst state, this is the best state when it comes to COVID. It's all about coming together and making sure those people that may have the infection
are well taken care of
and access care when they need it. So
and taking care of the people, we've seen in some isolation centers in Gombe, in Bauchi, the infected victims breaking out of isolation centers, that they are not being fed. They don't even the Panadol they have to buy themselves and the rest. Why isolate people when you are not taking care of them?
So there are several things here that we are already working on. So in the first instance, as I said earlier, 80% of those that have COVID infection will be well, or they will have very mild symptoms. So in those instances, it is not good use of our facilities to put them in a medical institution. It isn't. You put them, they need very little, if at all. They might have a headache and need paracetamol. The only reason why we're putting them in isolation facilities is in order to stop ongoing transmission in the community. We're not taking out that 80% in order to give them medication. And that's why we're saying to the state governments, identify hotels, identify non-medical facilities where you can put people and feed them 3 times a day, provide them with all the comfort and necessities that they are used to for the period that they are infectious. And beyond that, when they are no longer infectious, you put them back into the community. 20% will require hospitalization, and they are the ones that actually need a lot more resources. We'll be providing guidance, further guidance to the state governments in terms of what we feel the average cost should be per person. So for instance, if you have 1,000 cases in the next 1 week in a particular state, know that 800 of them would require some form of accommodation. And how much will that cost? 200 will require hospital care. Have you got the necessary beds for those 200? And so that you can, the states can have an idea of what the cost pressures are going to be. For a lot of the states, the reason why they are unable to look after these isolation centers is because they don't have the resources. They are paying for salaries. By the time they pay salaries and other parts of their day-to-day running of the state, they have very little left. But with good planning and projection in terms of what the numbers could be, we should be able to get on top of this. And we're looking at other aspects as well. We are approaching the voluntary sector, philanthropists, etc., to see if they can give out some of their empty buildings to governments, state governments, because all you need is good accommodation, good toilet facilities, and food for the period that they are infectious.
They are going to be,
and then they go back,
quarantined.
They go back into the community.
Okay. Very quickly now, let's look at some of the state governments transporting almajiris from one state to the other, and the rest, no testing done. Community transmission worries the PTF a lot. And 2, 1 week of the easing of the lockdown. How satisfied are you with the compliance level? Are you, after this second phase, going to recommend to go back to the old order, total lockdown again? So
my appeal, answering your second question, my appeal to the public is to please try and comply with the guidelines that we have set up. There is a lot of violation of the guidelines. You only need to go to Lagos and parts of Abuja to see it. These rules are all for our sake. We're not doing it for the sake of the federal government or the PTF. It's in order for the public to keep safe and to keep healthy and to protect our loved ones. If at the end of next week, we will be reviewing what we have done, we will reassess again, and then we will take that decision when it comes to taking the decision. But certainly we are quite concerned about the level of compliance, and as the Lagos State Governor said yesterday, quite rightly, that there may have to be a slightly different approach if things continue as they are.
And you want to tell me about the Almajiri?
So the Almajiri, I think we are making progress. We have made it very clear to state governments that this is not the right time to move huge numbers of people across state borders. If anything, whether Almajiri or not, we already have advised that interstate movement should not happen except when it's essential. And to me, moving Almajiris is not part of the essential definition of movement. We have communicated with the Northern Governors Forum. We have also communicated with the Nigeria Governors Forum, and I've spoken to some of the governors for the states involved. We are putting at risk states that do not have a major problem with COVID by moving people around. Now is not the right time to sort out the Almajiri problem. It will be sorted. I hope the priority is being given now in the north will continue post-COVID, because it's a problem that needs to be sorted. But certainly for now, people should stay where they are.
And you're going to at least try step up the issue of accommodation for your isolation centers and the rest. In Abuja, for example, the Nationals, the Moshood Abiola Stadium, which is supposed to be one of the isolation centers, is yet to come into use. This day dome is 95% complete. I'm sure before the end of this week or next week, you may be taking possession of that too. How about the hotels? I remembered one of the hotels in Abuja, Agura, was mentioned as part of the...
So we have Agura in Abuja. Actually, we have good isolation facilities. We have Agura, we have the National Women's Center. There's also a facility that belongs to one of the security agencies that we are currently using. In addition to that, we've got the Dome, as you mentioned, and we've got Idu. I think they are making up Idu as well.
Yeah, Idu is
to
being
provide. Yeah, our concern are states that are yet to even provide the minimum 300-bed isolation facility. And my plea to the state governors is to please, at a minimum, make sure that you have at least 300 beds available for isolating people in case this epidemic progresses in your state.
Can they use some of their tertiary hospitals, health facilities for these, for states who have teaching hospitals and the rest?
For the Christian, yeah. It's not good use of resources to put people in hospital. Put them in a non-hospital setup because they do not need any treatment. Leave the hospital for those that have COVID and those that have other health conditions so that people can continue to be looked after.
All right, thanks so very much. Dr. Sani Aliyu is a microbiologist with Oxford University, Cambridge University, and today he's the national coordinator of the Presidential Task Force on COVID-19. Very, very warm appreciation for coming on the Arise interview.
It's a pleasure, Christian.
That's our program for this week. For today, remember to join us tomorrow for another edition. Bye-bye.